Hello everyone, this is Lisa and today I'm going to share my personal Invisalign experience. So it's been a year already since I'm in treatment and I started all the Invisalign journey. I didn't post the video, just a simple thing why, because I didn't have the time and it does take time to just put it in all nice order and present it in better way than it was recorded. So today I'm going to share it with y'all. After your exam appointment, the assistants need to take your photos, panoramic self, and use iTero scanner to scan your teeth to have a 3D picture of your mouth. Then with all that information, the doctor can do his part and work on your treatment. So on your start day, the assistant going to place your attachments on the teeth and maybe buttons if you need a bite correction. Also, you will get the aligners. It's gonna be this kind of box, maybe like that, because they did change the design of it. And back from Invisalign with this box. In this box, you can find the cleaning crystals to clean your aligners, also the case to keep your aligners in when you are eating or brushing, and also the instructions from Invisalign. Now it's time to comment my video. So that video was made a year ago and you will see the change in my smile. Over here you can see everything what assistant is going to use. So right now basically I'm sitting on the chair and my friend, coworker, she's getting me ready. So she placed dry triangles behind my cheeks and then she placed in the cheek retractor to help maintain dry teeth during the procedure. The cheek retractor can be uncomfortable, so go ahead and adjust it. And then the beginning, before the assistant places any product on your teeth. Before actually she started to do anything, she actually checked my x-ray and she were holding the mirror too, kind of to check what fillings I have, if I have any fillings in my teeth, and if I have any crowns. I don't have any crowns, so I'll let her know. But she could see it, and we also can see it on your x-ray. Why we need to check that? Because the process can be a little bit different, so we need the extra things for us to place on your teeth to make sure the attachments will stay in. So she applied one product and now she's waiting a couple seconds, well it's like 30-40 seconds, and then she's going to rinse it with the water. And the suction is in my mouth, so it wasn't that bad. I just could taste it a little bit sour. So then she's drying all my teeth again, and after that she will apply a different product. And dry it one more time. So before she will place the tray, she had to fill it up with this special glue. So then she will check that, make sure that every attachment has enough glue in it, and just enough, not more, no less. And then she will place it in and push it with the special instrument, and then she will cure it with the light. and then the attachment will be hard and they will be like on your teeth, they're clear. That's why it's called Invisalign, so you hardly can see those. And she's doing one arch in a time, so in this case she started from the upper arch, and exactly the same thing she's gonna do on the lower arch. The difference is that on the lower arch we all have tongue, so there needs to be a long cotton to prevent your tongue go around the teeth and make them wet. So the upper arch probably a little bit easier than the lower one because it's easier to keep it dry. Like I said, so she basically doing the same thing for the lower arch. So she's shaking out the glue, just taking some off. I can see adding something. She will start curing from the molars because they're closer to the cheek and there's a bigger chance they can get wet. So we want to cure them first. So in my case, I needed bite correction. So she also going to place the buttons, they are metal. If attachments are made from the glue, so the buttons are actually metal and it's easier to break those. But I usually eat everything, meaning like it's not like with the braces, but some patient did break the buttons, so you just have to be aware of about that. Just remember that you have those in your mouth and just try to be careful. So doctor decided that I need the buttons on my lower first molars, so then I can hook it up the rubber bands to my upper canines. All is done. She's taking the aligner out, the template, and then she basically is checking out for all the attachments. Hopefully they're all stayed in. I think one didn't attach, so she will place it once again. When all the attachments and buttons placed in, the doctor will come and he's going to use the high speed and shape your attachments and make them more smooth and smaller, and he will place aligners on and make sure everything looks nice and fit well. What else I can add, that try to be careful, don't take your aligners out this way, just try to go from the inside and make yourself out, and just be aware of the buttons and try to wear your rubber bands because that's the part of the treatment. Teeth are gonna get straighter, but bite is very important as well. And this erase placing rubber bands for me, and so those I have to wear, and also it depends how many hours in a day I have to wear. That's the doctor will let you know for sure. Some doctors do recommend to eat in your aligners. Basically, I understand that, I see the logic. Then when you chew in the food is pushing the aligner and the aligner fits tighter on your teeth. But me personally, I never did that because it's like more work. You have to brush your teeth and you have to wash your aligners too. And while you're eating, you kind of cannot smile because all the food is just under your aligner. So I would take my aligners out when I'm eating or I'm brushing my teeth, And make sure don't place your aligners in the napkin or in the pocket or in the purse. They will just get lost, and to get the same set, it's not cheap. So just use the case from the Invisalign. Also keep in mind, if you will choose to eat in your aligners, some food can stay in those. I also don't drink coffee or tea in my aligners. I'm just taking them out because that drinks, and wine too, all the drinks can stay in your aligners as well. Try to wear your aligners no less than 22 hours, and just be aware of that you may have a lisp for the first 10 days because of the bite trims. If you feel like your aligner is not very tight and it's not sitting well on some particular tooth, so there's another option to help with that it calls chewies. So that's something which you can chew on. So they look like this, that calls chewies aligner tray sitters, and they look like this. So it's not very comfortable to chew on, but it's very useful. And like I said earlier, wearing your rubber bands is very important in a treatment, so try to do your best as well for the best results. If you have something broken, attachment on a button, just call your office and let them know, and it's nothing to panic about. They can just easily place it back for you. If your delivery date was on Monday, so we recommend to change your aligner on Monday night before you go to bed, so it will feel better already in the morning. It depends on your treatment, but you might change your aligner once in a week or bi-weekly. When I will have my refinement, I probably will make another video and I will tell you all why do we need the refinement and what is it for and how many aligners gonna be there and how long is gonna be the treatment again. Thank you so much for watching. I hope my video helped you and gave you more information before your actual Invisalign delivery appointment. Have a nice day and keep smiling.